Have you ever felt something shift deep inside your body? Something you couldn't quite explain? Maybe it was a change in the way you breathe, a sudden lack of energy, or a feeling that your body just isn't working the way it used to. As we grow older, these little changes can be confusing, even frightening. The truth is, our bodies are always speaking to us. Sometimes they whisper through small aches or fatigue, reminding us to slow down or rest. Other times, they send signals so powerful that they can no longer be ignored. Doctors, nurses, and hospice care providers know these signals well. They are the body's way of saying that it is preparing for a new stage, the final stage of life. Now, I want to be very clear. What we are going to discuss today is not meant to scare you. This isn't about everyday aging, the normal tiredness we all feel after a long day, or the stiffness that comes with the passing years. No, these are very specific, unmistakable warning signs that life itself may be nearing its end. They are the signs families often recognize only in hindsight, but you deserve to understand them right now. And here's why this matters. Knowledge gives you power. When you understand these signs, you can respond not with panic, but with compassion. Instead of being caught off guard, you can prepare emotionally, spiritually, and practically. You can spend more time on what truly matters: comfort, dignity, and the moments of love that make life beautiful, rather than being lost in fear and confusion. By the end of this video, you will know the 7 clearest signs that doctors and health experts say often appear as life approaches its closing chapter. You will learn how to recognize them, what they mean, and most importantly, how you can handle them with wisdom, acceptance, and grace. So if you have ever wondered, what does it really look like when the body is beginning to shut down? Stay with me. What you discover today could bring clarity, healing, and peace not only to yourself, but also to your loved ones. As we move further into this conversation, it's very important to pause and make a distinction that can ease a lot of unnecessary fear. Not every ache, not every moment of tiredness, and not every skipped meal means the end is near. Aging itself brings changes: slower digestion, weaker muscles, occasional forgetfulness, or nights where sleep just doesn't come easily. These are normal parts of life, and while they may be frustrating, they are not necessarily signs that your body is shutting down. But here is where the difference lies. True warning signs stand out because of their suddenness, their intensity, and their persistence. When something happens quickly, like rapid weight loss without trying, extreme fatigue that no amount of rest can fix, or a change in breathing that feels alarming, it deserves serious attention. These are not the gradual changes of aging that stretch across years. They are sharp shifts that often unfold over weeks or even days. Another way to tell the difference is this. Normal age-related issues usually improve with rest, good food, or a doctor's treatment plan. For example, you may feel stiff in the morning, but after moving around you loosen up. Or you might feel tired one week, but after sleeping better, your energy returns. End-of-life warning signs, however, rarely improve. Instead, they continue, deepen, and begin to affect every part of daily life. And we don't say this lightly. These insights come from decades of careful observation by medical experts, hospice caregivers, and researchers. Organizations like Healthline, which compiles medical guidance from physicians, and the Hospice Foundation of America, which trains thousands of end-of-life caregivers, have documented these patterns again and again. Families who have walked through the final days with loved ones recognize them too. So here's the key takeaway before we move into the 7 signs. Normal aging whispers, warning signs shout. If you find yourself noticing a change that is sudden, severe, and unrelenting, one that doesn't fade with time or treatment, that's when it's more than just getting older. That's when it becomes a message worth listening to. A sign the body may be preparing for something much deeper. And now, with that understanding in place, Let's step into the first of these signs, one of the clearest signals the body gives: rapid and unexplained weight loss. One of the earliest and clearest signals that the body may be entering its final chapter is sudden, unexplained weight loss. A change that can be startling not just for the person experiencing it, but also for the loved ones who witness it. This isn't the kind of slow, intentional weight change that comes from dieting or exercise. It's not the result of a new fitness routine or choosing to eat smaller portions. Instead, the pounds seem to fall away without effort, without reason, and often without the person even realizing it at first. Clothes begin to hang more loosely, rings slip off fingers, and friends or family may gently comment, "You've gotten so thin," even though nothing in the person's lifestyle has changed. So why does this happen? Doctors and hospice caregivers explain it this way. As the body begins to decline, its priorities shift. The digestive system, which once worked tirelessly to break down meals and extract nutrients, starts to slow down. Organs such as the stomach, liver, and intestines may no longer function at full strength. In some cases, the body simply stops absorbing nutrients the way it used to. Food may be consumed, but it's not fully processed or utilized. In more advanced decline, underlying illnesses such as cancer, heart failure, or kidney disease can accelerate this loss, draining the body of muscle and fat reserves. There is often a loss of appetite. Foods that once brought comfort, warm soup, favorite desserts, even the smell of coffee in the morning, may suddenly hold no appeal. A person may take only a few bites before pushing the plate away, saying, "I'm just not hungry." They may feel full almost immediately, or complain that flavors seem different or even unpleasant. Even when encouraged or reminded to eat, they may have little to no interest. This is not stubbornness. It is not a matter of willpower or choice. It is the body's way of conserving energy, directing its limited strength toward the most essential functions: breathing, circulation, and maintaining organ activity, rather than digestion. In other words, the body is slowly turning inward, preparing for the transition ahead. For families, this can be one of the most heartbreaking signs to witness. Meals are often a symbol of care and love. Sharing food is how we nurture one another. Watching a loved one refuse nourishment, or seeing them shrink physically, can stir feelings of sadness, worry, and even guilt. Caregivers may wonder, "Am I not doing enough? Should I try harder to make them eat?" But it is important to understand, forcing food rarely helps, and often causes discomfort. Recognizing this change allows us to shift focus, not on calories or portion sizes, but on comfort, dignity, and meaningful moments together. Hospice and palliative care providers, including resources from the Hospice Foundation of America and clinical insights compiled by Healthline, consistently list unexplained weight loss and appetite decline as key end-of-life signs. They remind us that this change is natural, and though difficult, it is not a failure of care. Rather, it is a message from the body itself. So if you notice rapid, unintentional weight loss, especially when paired with a declining appetite, it may be time to pause, reflect, and seek guidance. It may be time to shift the conversation from prolonging physical strength to treasuring emotional and spiritual strength. Because in these moments, what matters most is not how much is eaten, but how much love is shared. Another powerful sign that the body may be approaching the closing chapter of life is a level of fatigue that goes far beyond ordinary tiredness. We all know what it feels like to be worn out. A poor night's sleep, a busy week, or even just the normal slowing down that comes with age. Usually a nap, a day of rest, or a good night's sleep helps us recover. But when life is nearing its end, fatigue takes on a very different character. This exhaustion is not temporary, and it does not lift with rest. It is deep, unrelenting, and ever-present. A person may find that even the smallest tasks feel overwhelming. Walking across the room, standing up from a chair, or holding a brief conversation can feel like climbing a mountain. Something that once required little effort, brushing teeth, eating a meal, or simply sitting upright, may now leave them completely drained. This extreme tiredness is often accompanied by increased sleep. The body begins to spend more time at rest than awake, sometimes sleeping for long stretches during the day, waking briefly, then quickly drifting back into slumber. Nights may become restless, while the daytime is filled with drowsiness. The rhythm of life shifts as the body conserves what little energy it has left. In fact, hospice caregivers often note that in the weeks or days before passing, some people are asleep far more often than they are awake. Why does this happen? The answer lies in how the body manages its energy in the final stages. As organs gradually weaken, the body instinctively begins to redirect energy toward its most vital functions, keeping the heart beating, maintaining breath, and sustaining basic circulation. Available for movement, alertness, or interaction simply isn't there anymore. Metabolism slows, oxygen delivery declines, and the body chooses survival over activity. The result is exhaustion so profound that even staying awake feels impossible. For loved ones, this change can be confusing or even painful to watch. It may seem as though the person is withdrawing, losing interest, or giving up. But in reality, this is not a choice. It is the natural response of a body that is conserving every ounce of strength. In these moments, the best gift we can give is patience, gentleness, and acceptance. Understanding that presence matters more than productivity. Sitting quietly at the bedside, holding a hand, or simply being there becomes far more important than urging them to stay awake or active. This sign is well documented by healthcare experts. Health Direct Australia, which provides medical guidance on the physical process of dying, lists extreme tiredness and prolonged sleep as one of the most common changes in the final weeks. The Hospice Foundation of America also emphasizes that this withdrawal into rest is a normal, expected part of the body's preparation for its final stage. So if you notice that someone you love is sleeping more than they are awake, or if daily life seems to leave them utterly drained, it may be a sign that the body is slowly letting go. And while it can be heartbreaking, it is also an invitation. An invitation to focus less on what they can do, and more on what they can feel, comfort, love, and peace in the time that remains. One of the most visible, and often most unsettling signs that the body may be nearing the end, is a change in the way a person breathes. Breathing, something so automatic and unnoticed in daily life, can shift dramatically in the final stages. These shifts are not only physical, but also deeply emotional for loved ones to witness. At first, you might notice that breathing becomes shallow, or less full, as though the lungs no longer expand the way they once did. Sometimes the rhythm of breathing becomes irregular, with no steady pattern. A person may breathe rapidly for a short time, then suddenly slow down, as if the body itself has forgotten the rhythm. One specific pattern, often observed by doctors and hospice providers, is called Cheyne-Stokes breathing. This pattern involves cycles, periods of deep, rapid breathing followed by shallower breaths, and then sometimes complete pauses where no breath is taken for several seconds. To loved ones, these pauses can be frightening, making it seem as though the person has stopped breathing altogether, only for them to resume moments later. Another change that can occur is often referred to as the death rattle. This happens when secretions such as saliva or fluid build up in the throat or chest. Because the muscles of the throat and lungs are weaker, the body can no longer clear these secretions by coughing or swallowing. As air moves through the fluid, it produces a gurgling or rattling sound. While the sound can be alarming to family members, Hospice organizations like the Hospice Foundation of America and Healthline emphasize that this symptom is usually not painful for the person experiencing it. Instead, it is simply a reflection of the body's reduced ability to clear the airway. Why do these changes happen? As the body declines, the lungs become less efficient at exchanging oxygen and carbon dioxide. Fluid may begin to build up in the lungs or airways, the muscles of the chest and throat relax, and overall circulation weakens. Breathing, which once was effortless, now becomes a reflection of the body's limited energy and changing priorities. For loved ones, these breathing changes can be some of the most difficult to witness. The sounds, the pauses, and the irregular patterns often bring feelings of fear or helplessness. Families may sit by the bedside counting breaths through the silences, but it is important to remember what healthcare providers stress. These changes are a natural part of the dying process. They are not usually distressing for the person themselves, even if they are hard to hear and see from the outside. According to Health Direct Australia and the Hospice Foundation of America, such breathing changes are among the most reliable indicators that the end of life is approaching. For caregivers, understanding this can shift the focus from panic to presence. Knowing that while you cannot change the breathing pattern, you can offer comfort. Sitting close, holding a hand, speaking softly, or playing calming music can ease the emotional environment, even if the breathing itself cannot be controlled. So if you notice shallow breaths, irregular rhythms, long pauses, or rattling sounds, know this. It is not a sign of suffering but of transition. It is the body's way of gently letting go, preparing for what lies ahead. And while the pattern of breathing may falter, the love you give in those moments remains steady, unbroken, and deeply felt. As the body approaches its final days or hours, another clear sign emerges: changes in the skin and circulation. For most of our lives, our skin tells the story of health. Warmth in the hands, natural color in the cheeks, and blood flowing steadily to every part of the body. But when circulation begins to slow, the skin begins to reveal the truth that the body is shutting down. The first thing loved ones may notice is that the skin becomes cooler to the touch, especially in the extremities. The hands, feet, knees, and even the tip of the nose may feel noticeably colder than the rest of the body. This happens because the heart is no longer pumping as strongly as it once did. Blood, instead of flowing freely to the arms and legs, is now being preserved for the most vital organs, the heart, brain, and lungs. The body is conserving its limited energy rather than outward. Along with coolness, the color of the skin begins to change. Areas that were once pink or naturally toned may start to look pale, grayish, or even bluish. Sometimes families will notice a distinct pattern called mottling, a patchy, blotchy discoloration that often appears on the hands, feet, and knees. This mottling can look like purple or marbled spots, and is one of the most reliable signs that circulation is fading. According to the Hospice Foundation of America and Health Direct, mottling is not painful. Rather, it is a visual signal of the body's natural withdrawal from the physical world. These skin changes also reflect deeper changes in vital signs. Blood pressure begins to drop, the pulse weakens, and circulation slows further. The body is no longer working to maintain temperature, color, or warmth in the skin. It is channeling all remaining strength into the core functions that matter most in these final moments. For loved ones, these changes can be startling. To see once warm hands turn cool, or to notice the fading color of the skin, may feel like watching life itself slip away. Yet hospice providers remind us that these changes are not uncomfortable for the person who is dying. In fact, most are unaware of the coolness or the color shift. It is those at the bedside who notice most. What can you do in these moments? While you cannot restore circulation, you can offer comfort. Gently covering your loved one with a soft blanket, warming their hands with your touch, or simply being present can provide reassurance. Though their skin may cool, the warmth of your presence carries immeasurable comfort. According to Crossroads Hospice and Healthline, these skin and circulatory changes are among the strongest indicators that death may be near. They mark the body's final transition, where energy is no longer spent on maintaining appearance or outer strength, but on sustaining the inner essence until the very end. It is pale, bluish, or mottled, or if the hands and feet feel cool while the core remains warm, understand this. It is not a sign of pain but of release. The body is quietly preparing, and in those moments, your calm presence can be more healing than any medical treatment. Because while the body may show signs of shutting down, the love in the room, the connection between hearts, remains fully alive. One of the most tender, and sometimes most difficult signs that the body is preparing for the end is not always physical. It's mental, emotional, and spiritual. Many people begin to show confusion, disorientation, and withdrawal as their time draws near. First, you might notice small things. Your loved one might call you by another name, or they may forget what day it is. They may ask about people who are no longer alive, or speak about events from decades ago, as if they just happened. According to Healthline and Crossroads Hospice, these moments of confusion are not unusual. They are part of the body's and mind's gradual release. As circulation slows and oxygen levels in the brain decrease, it becomes harder for the mind to stay anchored in the present. This may look like difficulty recognizing familiar faces, places, or even the time of day. Sometimes they may respond with only a few words or not respond at all. To those watching, it can feel as though the person you love is drifting away moment by moment. Along with confusion comes emotional withdrawal. The person may stop engaging in conversations that once mattered deeply. They may stop asking questions about family members, or show little interest in what's happening around them. According to My Life Choice and hospice providers, this isn't rejection. It's the natural way the body and spirit turn inward, as one hospice nurse beautifully put it. It's as if the person is already looking through the doorway of this life into the next. Some people nearing the end may experience visions or hallucinations. They might speak about seeing loved ones who have already passed, or describe places they've never been. According to the Hospice Foundation of America, these experiences are very common and are not always frightening to the person going through them. In fact, many patients describe these visions as comforting, even peaceful, as though they are being welcomed or prepared for the next step of their journey. Restlessness is also possible. A person may pick at their sheets, fidget with their hands, or seem unsettled without knowing why. Hospice caregivers explain that this is often a response to the changes in the brain, a sign of transition rather than distress. For families, these changes can be heartbreaking. Watching someone who was once strong, clear-minded, and deeply connected slip into confusion or silence may feel like a loss before the final goodbye. But it's important to understand, this isn't a choice and it isn't suffering. It's part of the body's process of letting go. What can you do during this stage? Speak gently, even if your loved one doesn't seem to understand. Call them by name. Remind them of who is present. Offer reassurance through your voice and your touch. Even if they do not respond with clarity, studies and hospice caregivers agree, they can still feel the love, the presence, and the calm energy around them. So when you see confusion, disorientation, or withdrawal, remember this. It isn't a sign that the person has forgotten you. It's a sign that they are beginning to turn toward a different horizon. Their body is still here, but their spirit is already preparing for what comes next. And in those sacred moments, your patience, your gentleness, and your love can be the bridge that eases their passage. We've walked through 7 powerful signs that the body may give when life is nearing its close. sudden unexplained weight loss and loss of appetite, extreme fatigue and increased sleep, changes in breathing patterns, skin and circulatory changes, confusion, disorientation, and withdrawal, decreased urine output and signs of organ decline, loss of responsiveness and eventual unresponsiveness. Each of these signals can be deeply unsettling to witness, especially in someone you love. But it is important to remember, seeing one or more of these signs does not always mean that death will come immediately. Sometimes these changes unfold over days, weeks, or even longer. What they do mean is that the body is shifting, letting us know that energy, systems, and strength are being redirected toward the most essential functions. That awareness gives us a gift. It gives us the ability to respond with understanding instead of fear, with compassion instead of confusion. It reminds us that time is precious, and that every moment spent with someone we love matters. If you have noticed any of these signs in yourself or in a loved one, let this not be a cause for panic, but a call to attentiveness. Reach out to a doctor, a hospice team, or a trusted healthcare professional. You do not have to walk this road alone. There are people who can guide you, comfort you, and give you the clarity and support you need. And if you are a family member, a caregiver, or simply someone walking beside another in these tender stages, remember this. The presence you bring, the touch of your hand, the sound of your voice, the kindness of your words, these are not small things. They may not cure or reverse what is happening, but they can bring peace, dignity, and love in a time when those gifts matter most. So take what you've learned today and carry it not as a weight, but as wisdom. Share it with others. Talk about it with your family. And if you feel comfortable, share in the comments below. Have you ever noticed one of these signs in someone close to you? How did you respond? Another person who is struggling right now. Above all, never forget. Even as the body grows weaker, the person's value, worth, and dignity do not fade. The time left can still be filled with laughter, with memories, with moments of grace that you'll carry forever. Life is fragile, yes, but it is also beautiful. And knowing these signs is not about giving up. It's about preparing our hearts, cherishing what remains, and walking with courage through one of life's most sacred transitions.